My name is Chris Schwartz. I am a community organizer with Working Families Win, which is a part of Americans for Democratic Action, which has a long history of progressive activism dating from the 1940s when we were founded by Eleanor Roosevelt. So we are the living legacy of progressive movements, everything from the anti-war movements, the civil rights movement, to progressive economic movements today. Tonight's panel discussion is going to be talking about the upcoming budget sequestration when the big axe falls on March 1st if Congress doesn't dig their heads out of the sands before then. We're going to be talking about kind of the impacts that we're going to see in our communities if all these cuts go through, but also more progressive revenue-focused solutions to dealing with this problem, and mainly large U.S. corporations that pay little to no taxes or in fact get large refunds from the federal government instead. So I'm going to introduce my panel really quick. We'll get things started. They'll each have a little bit of time to present, and then we're going to open things up for a discussion and take questions. First, Pat Sass is here. She's from the Blackhawk County Democrats. She wanted to make a brief announcement.
I just wanted to invite everyone to attend our caucus, which is coming up. It's going to be March 10th, and it's at our headquarters at 512 Mulberry Street. From there on, we always have our central committee meetings the third Sunday of every month at 6 o'clock at the same headquarters on Mulberry Street. And I would also like to, on the League of Women Voters, and our state representatives are always at Area 267, and they will be there this Friday night. And it's human services is the topic. So.
At what, 4 o'clock?
4:30.
Coffee at 4 o'clock.
Yeah. Coffee at 4 and it starts at 4:30.
Okay.
Okay.
Great. There is one more seat up here in the front. Somebody wants to come up and take that. That'd be great. It'll make my photos look bad if it's empty, so someone sit up.
I won't bite.
And Sue won't bite. She promises. So I first want to thank, we've got some really great co-sponsors that helped put the word out about tonight. As I said, I'm with Americans for Democratic Action and Working Families Win. We also have the Iowa Alliance of Retired Americans, the Iowa Federation of Labor, the Blackhawk Union Council, the Communication Workers of America Retiree Chapter 70901, the Unify for Education Coalition, and Iowa Citizen Action Network, as well as Citizens for Fair Elections. So, introduce our panel really quick. First, here we've got Steve Abbott, who's with the Communication Workers of America. Steve has been a great activist in our community and across the state for a number of years, and a very vocal leader on many important issues. We have Rudy Jones, who is the Director of Development for the City of Waterloo. He's going to talk about the impacts that we'll see here locally in Waterloo, specifically what the city government is going to see in terms of what they can do with grants and such that are going to be cut and slashed. We also have Jan Laue, who is the president of the Iowa Alliance of Retired Americans, which is a really fabulous union organization that I've really enjoyed working with the last couple of years. Mitch Slater here is their organizer. It's just a really great group that I really enjoy working with. So I'm really pleased that she made the trip down here from Des Moines today. So with that, I'm going to turn things over and let Jan get started. So we're going to do the presentation, then we'll have a discussion afterwards. So.
Okay, thank you, Chris. Actually, I used to live in Waterloo, so it's kind of home territory for me. I'm going to talk, obviously, from a retiree's perspective for the most part, but I think it's something that everybody needs to look at in terms of, what's coming up. I retired last year, and, I always tell everybody that asks me how's retirement is great. Everybody should get to do it. So, retirees, we worry about the economy too. And we worry about our kids and our grandkids. And we want to make sure that they have the same opportunities that we have, so that these opportunities are not taken away. We don't want to saddle them with a huge debt either. But there's a right way and a wrong way to go about it. And the wrong way is to continue to grant these tax breaks for yachts and corporate jets and allow corporations like GE and this Dirty 30 to get away with not paying any taxes at all and getting refunds on top of that. That's all taxpayer money. And at the same time that we're giving these huge tax breaks to these corporations, they want to use this as an excuse to cut things like Social Security, Medicare, and Medicaid. So let me talk first a little bit about Social Security. Social Security did not cause this fiscal mess, and it shouldn't be used to fix it. The debt situation is just being used as a political cover to try to do something that they've been trying to do for years. Because even if they cut Social Security, it's not going to have any effect on the deficit. So the things that they're talking about, for instance, raising the retirement age. I mean, most folks here are working folks. And most folks probably aren't even sitting behind a desk. You're out there doing the hard, everyday, blue-collar type work. And to make you work longer before you get your retirement, some people just are not going to make it. You know, our bodies are not cut out for that. When they talk about the lifespan being longer than what it used to be, it's longer because they take an average. And the people who are really living longer are mainly the people who are richer and whiter. And people who work every day for a living tend not to be living as long. So they still need to retire at that age. The more troubling thing right now, I think they've kind of backed off on the age thing a little bit, but the more troubling thing is called the chain CPI. How many of you have heard of the chain CPI? Okay, this is a very, very stealthy way to reduce benefits, because it makes it sound like it's not such a big deal. But it's going to hurt not only current retirees, but it would hurt future retirees probably even more. It's based on the idea that you can substitute. You can substitute a cheaper item. So if you're buying beef, you can substitute chicken. And if you're buying chicken, maybe you substitute beans. And if you're buying beans, well, I don't know what you substitute really after that. But what you can't substitute is the thing that seniors pay the most for, and that's health care. You just can't go in there and say, well, I can only afford a double bypass even if I need a triple bypass. You know, that's just not going to work. So this chain CPI is really a dangerous thing. And that doesn't even take into account the people who are already living on beans and are on the edge. And those are the folks that will hurt the most. They spend every cent that they get on necessities and access what programs they have, and if we cut them even more, I mean, they're down to the point. I know one lady that we interviewed in a project that we had, if she had a flat tire, she had to borrow the money. She didn't have the money to cover anything like that. So it's a bad situation and something that we shouldn't do. Social Security is a promise made to Americans. It's a legacy from going back to Franklin D. Roosevelt, and it's a promise that we ought to keep. The second thing I want to talk about is Medicare. This is another place where they're talking about making cuts. And, you know, instead of giving tax breaks to wealthy corporations, we shouldn't trade off the health care of our seniors that we promised them for many years. So, again, they want to raise the age at which you can get Medicare. This is really a disaster. If you raise the age of Medicare eligibility, say from 65 to 67, it's going to save the federal government about $5 billion over 10 years. On the other hand, it's going to cost everybody else more. Those people who are in the 65 to 66 year age group, I mean, you can imagine what they're going to have to pay for insurance, because they're going to be considered the most expensive group of people. So they're going to have to pay more. I think it was estimated about $3.7 billion more that they'll have to pay. Well, this group that's left in Medicare then are the older ones, you know, over 67. So in that group, because your pool doesn't have what is the relatively cheaper people, the 65 and 66-year-olds, that means their costs go up by 3%, it's estimated. Well, when these 65 and 66-year-olds get thrown into, you know, the group with the younger folks, That raises their costs because they've got these more expensive people in. So you're having the worst of all worlds. It's going to shift the cost to individuals, to employers, if they still cover you, or to the state. And all that for $5 billion over 10 years to save the federal government. Another thing they've talked about is vouchers. Hopefully they've gotten rid of that idea, but that's just a way of privatizing Medicare. There would be no guarantee on how much money you would get if it would cover what insurance you needed to go buy, and you would need to go out, send seniors out on their own with all these insurance companies to figure out what kind of coverage they should have. A total disaster. Now, so far I've talked about what not to do. There's a couple things that, it boggles my mind that they don't take a look at. And one is negotiating drug prices. Right now what they do under Medicare is the pharmaceutical companies get whatever price they ask. There's no negotiation going on like there is, like with the Veterans Administration, for example. And it's been estimated that if they negotiated this, it would save $200 billion over 10 years. Another thing that they don't do is if a person on Medicare is also eligible for Medicaid, the lowest income seniors. Medicaid, they give a discount. They don't give that discount to seniors on Medicare. So let's say you were on Medicaid and they were doing that discount, then you get to be 65 and you go on Medicare, then they quit giving the discount. If they just continued the discount, that's $135 billion over 10 years. Now think about these figures that I've just given. The thing they're really pushing is the age, raise the age, $5 billion. Negotiate health care, $200 billion. Why aren't we doing that? Or 135 even. Why wouldn't we do that? Why are we only looking at the $5 billion and not the $200 billion? So, that's a way we could save money, and it would help to lower the deficit as well, without cutting benefits. And then there's Medicaid. Medicaid is a lifeline for millions who can't afford private insurance. Most of the Medicaid recipients are children, but most of the money actually goes to seniors, covering nursing home care and that sort of thing. In 2009, Medicaid provided $3 billion in benefits to Iowans. That's 14% of all health care spending in this state, and it insures 1 out of 6 Iowans. So the problem basically with both Medicaid and Medicare is health care. It's the cost of health care. What we really have to go after is to get the cost of health care down. Now the Obamacare actually starts to do some of that, to look at the way we pay for health care, in that it pays for outcomes rather than how many procedures you get done. And so that's a better way of looking at it. And there's other things that probably can be done, but at least it's a start. What we need to do is to close a lot of the tax loopholes that are out there to get more money to help lower that deficit. And I know the folks on the panel are going to be talking about more on that area. I mean, we've looked at a couple of things in terms of loopholes, and corporations in particular, they complain about the taxes, even though a lot of them don't pay any taxes, and yet they probably have the lowest effective tax rate in the world. And by effective tax rate, I don't mean the official tax rate. It's what they actually pay. So these corporations that pay no taxes and get a refund, their effective tax rate is actually a minus. They pay less than nothing because they get money back. The very best way, actually, to deal with this deficit is to create jobs. If everybody had jobs, decent paying jobs, they could pay into the system, they would pay more into Medicare, into Social Security, pay more in taxes, and it wouldn't be an increase for us, but it would be more into the system and everybody would benefit. Those are my comments at the outset, and we'll take questions later on, I guess.